everyone, my name is Georgi. Today here with me is Chaitra Dinesh, IFMSA Scopy External Development Assistant, who will guide us and provide insight into the crucial subject of universal health coverage and global health campaigns whose main objective is providing equal health coverage for everyone on the planet. So Chaitra, tell us something about universal health coverage and its aims.
So universal health coverage means that all people and communities can use all the health services they need, promotive, preventive, curative, rehabilitative, and palliative, of sufficient quality to be effective, while also ensuring that the use of these services does not cause any financial hardship. And that's the WHO definition of UHC. There are three main objectives for universal health coverage. Number one is equity in access to health services. So we're making sure that everyone has access to what they need. It's not just about being equal, but also having what you need. Then there is number two, which is the quality of health services should be good enough to improve health. It's okay having lots of hospitals, but if the quality isn't good, it can really cause harm. And number three is people should be protected against financial risk. Unfortunately, for most of the world, the amount of money that they have to spend when they go to hospital is a lot, and they will have to spend money to even access healthcare. And this can cause a lot of hardship for them. To measure universal health coverage in different countries, there are two main things that we look at by the WHO and the UN, and this is the proportion of a population that can access essential quality health services, so how many can actually get to the healthcare system services, and the proportion of the population that spends a large amount of household income on health. So this can be spending on vaccinations, on medications, on inpatient stays. So if they spend 70% of that on health, they have very little left for everything else, like school, like food, like shelter. So this is how they measure universal health coverage. In different places, you'll see different countries having different universal health coverage statuses. Currently, you just look at what the WHO and the UN have said to know what is the status of a particular country.
Okay, thank you very much. What about the Global Health Initiative?
So Global Health Initiative in IFMSA contains many different things. I am the External Development Assistant for Scopy, so I know a lot about what Scopy does and a little bit about what everyone else does. But all standing committees work on universal health coverage in their own different ways, and so does IFMSA in general. So some of the things that we do is that we have in Scopy something called the Global Health in Exchanges Guidebook. This guidebook contains information on like the social determinants of health, how to talk about health equity, and also talking about healthcare systems and universal health coverage. So this document is available to exchange officers and to anyone else if they're interested. So it's a really good document to just look through. There's also the Scopy Global Health Framework, which was passed in 2019, and this covers the theme of the framework is universal health coverage in health systems, and the aim of this is to sort of improve the amount of information students learn about universal health coverage and health systems in their own countries and when they go on exchange. So we are always trying to make sure that in the General Assemblies we have sessions related to universal health coverage and global health, and that we also encourage NMOs, NEOs and LEOs to do global health workshops. So that's two of the main initiatives that are there. There's also something that's coming up called the Global Health Weekend, which we're hoping to do in June. And this is just focusing on the topic of access to healthcare and trying to get local exchange officers, national exchange officers' views on the healthcare systems and to sort of promoting it through an exchanges perspective to the whole of IFMSA membership. So these are some of the global health initiatives that are there currently.
Excellent, thank you. So I'm sure that anyone watching this is wondering in which way a medical student could contribute to achieving these goals.
So as a medical student, to contribute to something like this, and any global health issue, is to, I'd like to think about it in 3 different ways, is to educate, advocate, and act. So education is about educating ourselves and educating others. So there is something called the UHC simulation that was created by the small working group on UHC simulation. And this is a simulation that ran in a March meeting 2019 and August meeting 2019 of the IFMSA. And it's basically a way of teaching you in a fun, interactive way the difference between having universal health coverage and not having universal health coverage. And this has been shared with NMOs. So it has a manual on how to run the simulation. There is also action cards and a explanatory document, and evaluation forms to assess the impact. So this is something that you can do so you can take part in if your NMO does it, or you can organize to do it in your local committee. And that's one way of educating yourself. Also, there will be lots of professors and lecturers within your country that has knowledge on global health and universal health coverage. So inviting them to come and speak to the students and come to speak to yourself. You can also get involved with any other teaching or learning opportunities that are there, especially online ones now, because we've all come into that world. Then advocate. So advocate is where we need to sort of talk about the needs of the population. So as the future healthcare workforce, we have a lot of in-depth understanding of being both a patient and also a future doctor. So you can also think about, okay, what do the people need and what is not being provided? So it's to start talking about all of those things. So talking on behalf of, for example, the migrants or the refugees or the vulnerable population, the elderly. And then finally, it's about acting. So act is where you would actually do something yourself. So you could write a letter to your local member of parliament. You could join a protest. And for me, in a biased sort of way, the best type of action is to go on an exchange. So, when you go on exchange, you actually learn about different healthcare systems and medical education systems in your own action. So it's perfect to really understand universal health coverage.
Thank you. So what can we do as a medical organization, and how can MMSA take part in accomplishing equal health for all?
So one of the things that MMSA can do is, as I mentioned earlier, is to do the UHC simulation in your NGAs or in your conferences, and also to encourage local committees to try and organize them for their local students. I know currently it's not possible because we can't all meet up, but in the future, this can be something that we do. And again, using the Global Health Within Exchanges guidebook that I mentioned earlier, you can do different workshops that are mentioned in there, getting externals involved, doing online webinars, talking more about the situation within your own country and also in other countries worldwide. Another thing is there are 6 key asks of the UHC. So they really want to achieve universal health coverage by 2030, and there are 6 key asks that they have. And these 6 key asks are as follows. And we can, as MMSA and as a national member organization, do lots of work for each of these key asks. And this can be just a nice way of separating out what to do for universal health coverage. So key ask number 1 is to ensure political leadership beyond health. So this is really getting involved with all the political members in your sort of local areas in your country to sort of be like, okay, we need to get good healthcare, and for that we need good roads so that people can access the hospitals. So we need the Department of Infrastructure to get involved, for example. So it goes beyond health. Key ask number 2 is to leave no one behind. So this is, we have to make sure that we always advocate for those who are less, don't have as big a voice. So people like the homeless, the vulnerable populations, maybe women's health is not as good as it can be. So it's about making sure that we get their voices heard as a medical student body. And key ask number 3 is legislate and regulate. So if there are any new laws or any laws that are changing, need reviewing, that are coming up, maybe the National Health Service in Macedonia is looking at expanding their understanding of legislation or changing things, it's a good opportunity for us to get involved in that and to advocate for the needs and to sort of make sure that the rules and regulations help everyone. Key ask number 4 is to uphold the quality of care. So this is where we make sure that all the different hospitals and general organizations have really good quality. So even the community hospital in a village is really good, and so is the tertiary hospital. I mean, the resources will be different, like the tertiary hospital might have more specialist care, but the main basic services should be of really good quality in both places. Key ask number 5 is invest more and invest better. So some countries don't really spend enough on healthcare and spend it on other things. So we can advocate that you spend more of the taxes on healthcare. And investing better is some countries spend a lot of money on healthcare, but they spend it all in like the big hospitals. So the primary healthcare system or the preventative treatments are not as great. So we need to sort of ask them, look, let's invest more in preventing diseases so that we don't need as many big hospitals or as much money spent on end of life kind of things. So it would be like preventing smoking or helping people quit smoking or reducing the number of alcohol-related deaths, etc. And key ask number 6 is to move together. So health affects everyone. So we need to make sure that we incorporate local community students who are not just medical related to talk about universal health coverage. For example, getting like the workforce, Department of Work and Pension to think about maybe giving their employees some kind of insurance package or help with healthcare. So these are the 6 key asks that we as an NMO can think about to achieve or help with universal health coverage.
Excellent, thank you. So how have you addressed this in the UK and what results have you seen so far?
So in the UK, we did a conference on UAC. It was called Health Access for All, and we had different lecturers come and talk to us about different aspects of universal health coverage, and also we had workshops and trainings on it. We ran the UAC simulation there, and many people joined in, and they really did enjoy it and learned quite a lot about universal health coverage. We also have did an online campaign. So around the same time, so IFMSA did an online campaign around Universal Health Coverage Day, which happens on the 12th of December. So they did a campaign where they incorporate all the different standing committees. So in the similar way, we did an online campaign about the 6 key asks and relating them to the UK and what's available here. We also attend some parliamentary events. So our national president goes to some events such as there was one on ending preventable death. So we went and talked to them about the students' perspective. We've also joined up with some other global health organizations in the UK. So these different organizations are not medical student led, but they're led by different people, and they all focus on different aspects of healthcare, from looking at neglected diseases to HIV and AIDS, or to non-communicable diseases. So we work with them to push for universal health coverage all over the world. In the UK, there is a form of universal health coverage already, and this is mainly due to the fact that after World War II, they realized that health is very important for everyone, and healthy people means that the country survives. So that's where the National Health Service in the UK has become sort of universal health coverage ways. And interestingly, there's been a lot of discussion that after the COVID pandemic, maybe many countries will go towards universal health coverage. And sadly, you need like a big problem to happen before something happens. So maybe that's an optimistic way of looking at this pandemic right now.
We have to have at least somewhat a positive outlook, I think. So thank you very much. And to wrap it up, what is a message that anyone watching this should take from the video?
Oh, okay. So I would say that in all fields of global health, there are challenges to face and overcome. As future healthcare workforce, it's essential that we are aware of these challenges in our own country and globally. And to achieve universal health coverage, we need to make sure that we educate ourselves and others, advocate for those in need, and create actions that have long-lasting impact.
Thinking we can safely conclude our meeting, having addressed these fundamental questions regarding this topic. So I just want to have a few words regarding the current pandemic. The curve is flattening, yes, but the threat is not over, so keep practicing social distancing, stay home and stay safe. So goodbye everyone, and thank you for watching.